Turning to some COVID news now, U.S. health officials are raising the alarm about the growing use of the deworming drug ivermectin as a so-called cure for COVID-19. Not only does current research not support the claims circulating online, but the demand has led customers to seek out the veterinary form of the drug, both stateside and here in Canada. Now, a number of livestock supply stores are being inundated with calls, forcing at least one shop owner near Calgary to pull ivermectin from the shelves. The CBC's Sarah Galashan has been following this story for us. Sarah, it sounds absolutely incredible. This isn't the first time we've seen this. Tell us more.
Right. So it's Lone Star Track and Field outside of Calgary that's telling our colleagues in Calgary that they have decided to pull ivermectin off the shelves because, like other feed stores like them, they are being inundated, frankly, by calls and online requests for ivermectin, the veterinary form of ivermectin, I should say. And they're concerned that the customers who are making these inquiries intend to use it for purposes otherwise that it is not intended for. It is a drug that is specifically designed to kill parasites or worms in the guts of livestock, like horses or cows. They are concluding this about the customers who are calling in because of the kind of questions they're being asked, and because in Alberta you require some kind of an ID number in order to purchase veterinary medicines, which these callers and online requests don't have. Still, they're trying to circumvent the rules. There are what most experts would call dubious claims circulating online about the effectiveness of ivermectin as a prevention or a cure for COVID-19. We actually spoke to an epidemiologist trusted by News Network in the past about where these claims might be coming from, and this is what we were told.
The people who are advocating it are basing themselves on a study that came out of Egypt that has since been retracted because of issues regarding to plagiarism and data fraud. So that study that supported the use of COVID-19 is likely not true. There is other research that shows it doesn't work. The issue with ivermectin is not some conspiracy or some ideological or political difference. It does not work.
To that, there are other trials looking at ivermectin, but one of the largest of those actually was disbanded early in August because ivermectin, as it pertained to COVID-19, was shown to have nothing more than a placebo effect. Other drugs, of course, do treat COVID. They are used in hospital. Prednisone, one of them, but it is not available to the public. It is something that is only used in hospital. And ivermectin is something that is available in a human form, if you will, but it is prescription only, and it is used to treat illnesses that are caused by parasites. That is not what COVID-19 is. The CBC did reach out to Alberta Health Services. They say they did look at ivermectin, but they do not think that it is effective. They are certainly not recommending it for a treatment for COVID-19.
And in terms of the livestock form versus the human form, as you say, that it isn't safe for people, what's driving the interest then for the livestock version?
So it's hard to say exactly where this interest is coming from. It has been actually sustained. The operators that CBC spoke to say that they've been receiving these calls and this level of interest for a number of weeks now. And it's not just in Alberta that we're seeing the interest. In Saskatchewan, there's this tweet put out by the Saskatchewan Health Authority trying to bust the myths of ivermectin as opposed to taking a vaccine, which is, of course, what health authorities across the country are recommending in terms of fighting and protecting against COVID-19. The reason to turning to the animal form of ivermectin, as you say, is because of it's difficult to get, obviously, in a prescription form. If you're not dealing with a parasite issue, it is maybe less difficult to get in a livestock form. But to that, it is a real issue, especially in the United States, because the CDC has reported a 5-fold increase in terms of calls to poison control related to ivermectin back in July. And to that, the FDA says that if you are taking a dosage of ivermectin that is intended for, say, an animal, you potentially can make yourself very sick, vomiting, seizures, diarrhea. And according to the FDA, you can even die from this.
All right, some really important information there. Thank you for this, Sarah. That is Sarah Galashan reporting in Coquitlam, BC. All right, so perhaps this requires a little bit more discussion, and for that, I want to bring in Dr. Raj Bhardwaj in Calgary. He is an urgent care physician and a health and medical columnist for CBC News. Hello to you. Welcome to the program.
Thanks, Arthi.
All right, so Dr. Bhardwaj, why don't we start by maybe having you explain to our viewers what ivermectin is and what it is actually used for, because there is a version that is used.
Yeah, so I don't know it as a horse or cow medication because I don't treat horses or cows. But honestly, in my over 20 years of working, I think I've prescribed it maybe fewer than 5 times. It's used for parasitic infestations, so worms in your gut or worms under your skin, things like that. It can be used for really bad cases of lice and things like that as well, but that again is off-label use. That's not what it's really meant for. And it comes in a sort of a topical, like a cream type preparation. It also comes in oral preparations. But like I said, in 20 years, I've prescribed it maybe a handful of times, and that's mostly for people coming from tropical countries where they have, proven to have a worm living in their gut or under their skin or something like that. This is not something that I prescribe, even yearly.
And so this is the version of ivermectin that is on the World Health Organization's list of drugs. It is not the livestock version that we're seeing these businesses in Alberta, for example, pull off the shelves because there's been concern about people trying to use the livestock version. Wondering what sort of conversations you've had with your colleagues, with your patients about the use of this. It is something we heard in the United States earlier in the summer. So are there questions that are coming to you and your colleagues about this now?
Luckily, I think that the vast majority of people out there realize that taking an unapproved drug that has been studied for both prevention and treatment of COVID, but has not shown good results, that taking an unapproved drug is not a good idea. And I think that the vast majority of people sort of look at that and say, okay, well, I'm not going to take that if my doctor doesn't recommend it. But there are, a handful of folks out there who are usually quite loud on the internet and social media and places like that. And sometimes their posts go viral. And so people do come in and ask us about it. But again, most people are reasonable. And when we explain to them that this is used for, worm infestations and that there's absolutely no evidence that it helps for treatment of COVID, people are quite happy with that. And it's weird, because these are often the same people that want a quick and easy answer to their COVID infection or to maybe prevention of COVID. And this is one of the few times that medicine actually has a quick and easy answer, which is go get vaccinated. It reduces your risk of ending up in hospital or having severe COVID illness, by 80, 90% or more.
So you made 2 points here that I do want to dig a little bit deeper into. So first, I want to talk about the study because you did mention that there had been some evidence or a study into ivermectin. Where did that go?
So there have actually been a number of studies into ivermectin, and there have been reviews of those studies as well. So remember, not every study is a good study, and not all studies are created equally. So a lot of the studies that look into ivermectin are incredibly small trials. We're talking, 10 or 20 patients. They don't necessarily have a good scientific method where they divide the group of patients and say, okay, you half are going to get ivermectin, you half with similar disease are going to get a placebo, and you don't know who's got ivermectin and who doesn't. And then we'll see how everybody does. So those studies, that would be a good study. Most of the studies on ivermectin are not good studies. And there still are studies ongoing because we don't want to, close the door on potential treatments of COVID, whatever they may be. But so far, with all the studies that have been done, there's not been any evidence that ivermectin would be good for treatment or for prevention, which is why we don't use it.
And the second point that you made that I do want to also ask you to elaborate on there is loud voices on the internet, Dr. Google, and how that might be fueling some of this misinformation that we're seeing and the broader impact of it.
Yeah, I think that in general, people want to find easy answers for complex problems. And COVID is a complex problem, right? I mean, there's the medical implications of it. There's the social implications of it with distancing and, masking and things which have become quite politicized. There are other implications with regards to, who is more prone to catching this infection, people who work in factories, people who are otherwise marginalized, maybe people who are of lower income, people who don't have supports like being able to go home and isolate when they do have COVID infection. People want an easy answer. And, for some things, that easy answer is, oh, go on this fad diet, or take this pill, or take this multivitamin, or walk 10,000 steps and you'll be healthy. And that's the only one thing you have to do. But with COVID, there's not one thing that we have to do to bring this pandemic under control. So, when even when we speak of vaccinations, vaccinations are probably the biggest thing that we can do to bring this under control. But vaccinations on their own, especially with Delta, aren't going to solve the problem either. So this is we need a multifaceted approach, and we need a rational approach. And taking ivermectin is neither of those.
And finally, I wanted to ask you, because this is not the first time that we've seen misinformation really turn into a detrimental situation with people consuming things that have been touted on the internet as to be a cure for COVID-19 or for other diseases or viruses for that matter. So I just wanted to ask you for your advice for individuals who are consuming information online or from people who they trust about these potential cures that could in fact be detrimental to their health.
Yeah, it's really tough. I think that it's easy to get caught up in the latest trend or the latest fad. I've been seeing all sorts of videos about people doing the milk crate challenge. Before that, there was the Tide Pod thing. There was all sorts of things online. But you have to sort of stop and step back, especially when it comes to health and science and medicine, and say, okay, where is this information really coming from? And is it verifiable? And it's very easy to do a little, Google search and find out for yourself, like, is this legitimate information or not? And I think that it's a lot easier, though, to just, retweet or click on it or like it or forward it to a family member or friend. And that misinformation becomes the virus, that becomes a whole pandemic of itself. And that's a dangerous thing, whether you're doing it because you think it's cute or because it's interesting, or, maybe you're a little bit more conspiracy minded or whatever. It's a dangerous thing to do. And I would encourage people to actually go to legitimate sources of news to find out if, to at least think about what they're reading elsewhere.
A critical message from you today. Thank you so much for your time, Dr. Bhardwaj. That is Dr. Raj Bhardwaj, and he joined us from Calgary.